Okay, cavernous sinus. What is it? Well, it's venous sinuses on either side of the pituitary, and essentially just drains blood from the eye and from the face. And where does that blood go? Right into the internal jugular vein and then back into the heart and to the rest of the body. And really all that you need to know about the cavernous sinus is what's inside of it. I swear, the only question that I've ever seen is an anatomical question. And they're going to give you this picture, and they're just going to have it completely blank, nothing labeled, and they're just going to point with one arrow just to one of these structures, and they're going to say, what is it? So what are these structures? We got cranial nerve 3, cranial nerve 4, cranial nerve V1, cranial nerve V2, and then we got cranial nerve 6. And then you also have portions of the internal carotid artery and these sympathetic fibers that go to the pupil. And the only pathologies that are really ever involved with the cavernous sinus are pituitary tumors, cavernous fistulas, cavernous sinus thrombosis, some infections. And I mean, they can all really present in very different ways because there's so many different nerves in there that can all lead to different sensations and different motor deficits. But in my experience, it really does not matter because they're really just going to show you this picture. They're going to point to a nerve, or they're going to say, what is it, or what is the deficit you're going to see with this nerve? So if it's cranial nerve 3, you're going to get some kind of oculomotor deficit. Cranial nerve 4, obviously you're going to get some kind of trochlear involvement. V1, V2, different sensory involvement involving the V1, V2 area. And then cranial nerve 6, you would get an abducens palsy, and then whatever involvement there is with the pupillary sympathetic fibers.